All right, 67-year-old man has fatigue, weight loss, worsening lower back pain, constipation, and new onset nocturia, and mucosal pallor and tenderness over the lumbar spine. These are the labs. Urine protein electrophoresis is most likely to detect what? Okay, let's dive into this. So, plasma cell disorders is what we're thinking of, and we got a guy who has multiple myeloma. All right, so let's talk about this. We got fatigue, back pain, maybe some constipation, anemia. We got, look at this, that's high calcium. And then look at this, that's high creatinine. Boom, boom. Okay, and then look at that. So that right there should tell us that we got some myeloma. So if we combine anemia, high calcium, bone pain, kidney issues, multiple myeloma is what we're thinking of. That is a plasma cell cancer, and those plasma cells are pumping out tons of one specific antibody piece, usually free light chains, which are like lambda or kappa. And these small proteins are too tiny to be seen on a urine dipstick, which only checks for albumin. But they're still in the urine. They're just invisible unless we do a special test. So what do we do? Urine protein electrophoresis. That's where that comes in. And that's why they're doing this test here. And so how does this cause the kidney problems? Well, light chains go into the kidney, and normally the tubules clean them up. But in myeloma, there's way too much of them. And so the light cells stick together with the TAM-Horsfall proteins and form casts. And these block up the tubules and cause the kidney damage. And so you get the light chain cast nephropathy, which is known as myeloma kidney. And so it's going to be the free lambda and kappa chains. Boom, that's the answer. Multiple myeloma, you think of CRAB, calcium increase, renal failure, anemia, bone lesions. Urine dipstick is normal because it misses light chains because they're tiny little guys. And the urine electrophoresis is positive for the light chains. And then these light chains cause the kidney damage, not the albumin. Okay, and the only other thing that you need to know about myeloma and other related conditions would be, let's say if we had low hemoglobin, high calcium, high creatinine, and then a normal dipstick, that should also make you think of the same exact thing. The only other thing I'm trying to think of is like the other special tests that you're not going to be tested on, like the SPEP, that like in the blood, like serum protein electrophoresis, and serum free light chain assays that quantifies like how much there is. But yeah, just know that free light chain formation, you make tons of them and they cause kidney damage problems and CRAB, and yeah, you're good to go. So hopefully you guys are doing well. Hopefully this was helpful for you. Hopefully it cleared up a little bit of confusion. Hopefully just myeloma is cancer of the plasma cells. Myelo means bone marrow, or like spinal cord sometimes. So hopefully that helps. Just little things like that can go a long way. Yeah, so feel free to hang around the end of this video, or just watch another video. I don't know. Do whatever you want to. But yeah, I mean, maybe I could just keep talking about myeloma or something. Plasma cells, Rayleigh formation, AML, CML, blast cells, neutrophils, different stages, myeloid, myeloblasts, granulocytes, monocytes, myelomas, or plasma cells. I don't know. Get out of here.